Welcome back. I'm your host, Michael Stamatinos with the Advancing Healthcare Innovation Show. And if you're new to us, we're really excited to have you here. We happen to be very passionate about healthcare innovation and adoption, things like access to care and leadership. And if this is your first time tuning in, let me just tell you a little bit about what we're doing here. So we're a healthcare innovation company, and we're really focused on bringing stories of innovation within healthcare to life. And it's really aimed at highlighting real people who are truly innovating within our space and give them a platform to share their stories with the world. And we have an incredibly action-packed year ahead of us, planned with some incredible new content, some amazing speakers. And if you haven't checked out any of the historical interviews, feel free to do that now. And if you want to get any of the new episodes coming right into your inbox, just hit subscribe now and they'll come right to you. So I'm delighted for our next guest, Paul Uhrig, who's the Chief Legal and Digital Health Officer for Bassett Healthcare Network. Paul, welcome to the show.
Thank you, Michael. It's great to be here.
Yeah, so let's dig in a little bit. So before we kind of dig into talking about Bassett, maybe we talk about the conundrum going here, an attorney and someone who's in innovation. How do both of those things come about? So share with the audience maybe a little bit of your story and how you kind of came into Bassett, and then share, larger context about Bassett and what you guys are doing.
Sure. No, that's great. So, until a couple of years ago, I was a lifelong resident of Washington, D.C. Started my career very much in a traditional legal sense, right? Working for health firms, private practice. Also, my entire career, I've been doing healthcare, representing hospitals, insurance companies, ancillary providers, worked in medium-sized firm, worked in a small, very entrepreneurial firm where we did some very interesting things around healthcare. It sort of ties to the future. We did a lot of work in the 90s with physician hospital organizations, right? Really sort of
Mhm.
almost the early days of value-based care, where we were asking physicians to keep patients out of the hospital, focus more on health rather than just treating
Right.
sick people. And it was a few years early, and I'll tie this to my later years. So in early 2000, decided I wanted to start doing something a little different, and so I went to work with what at the time was really still a startup that became one of the largest health information exchange networks. So really got into one, the whole topic of interoperability, the sharing of data was really there sort of in the early days when Governor Levitt, then Secretary of HHS Levitt, was starting the American Health Information Community. And sort of, we've been doing it a long time, but, it was really a catalyst for a lot of the information sharing. So that company, now is one of the largest, if not the largest, health information exchange in the country. And I started doing many different things at that company. So I always kept sort of the legal hat and the legal function and compliance and all those things that a lot of people don't want to do. But started getting into more of the business, policy, and we were really sort of treading new ground. So sort of got that bug, if you will, about how do we change healthcare for the better. And how I ended up at Bassett is we've always had a home here for about the past 12 years, a lot of family here. So when COVID hit, we came up thinking, well, I'll be here a couple of weeks and then we'll go back home. CVS will have the paper, all will be good. We know how that turned out. And so we decided to make Cooperstown our permanent home. And an opportunity came up at Bassett Healthcare. That was a great opportunity. So Bassett is a health system, a 5-hospital health system here in central New York. We serve a very rural area of about 5,600 square miles, so about the size of Connecticut. And really going through some transformation, brand new CEO, brand new executive team. And so it was a great opportunity for me because I could continue to combine sort of my legal career and we were very much looking to how could we bring innovation into Bassett and into Central New York. So, I jokingly say I'm a little schizophrenic, right? As lawyers have a reputation of always being the one saying no. And when you're doing innovation, it's like go go go. Let's get it done. So, but it's great being able to wear both hats.
Well, historically, was Bassett known as an innovative entity, and did that have to change culturally when new leadership came in? What's that process been like?
Well, Bassett, it has a long history, right? We're celebrating our 100th year anniversary.
Yeah.
For a health system in a very small town. Cooperstown is a village of 2,000 people. Bassett really has some very unique assets and really has shown innovation, right? It's been a leader in some healthcare innovation in the past. And so, we have a great research department looking at various research and clinical trials. So it's always had that spirit of innovation.
Mm.
But really, these are very different times, right? When you think of the amount of money going into digital health and some of the challenges that we're experiencing. So, I think the pace of change has increased, the need to change has increased. And so it's been a journey, right? To
Mm.
as we adapt to this new world. Some of it prompted by COVID, obviously, and a lot of it prompted by this innovation in digital health.
So let's talk about maybe before we get into the wins, because a lot of people like to talk about the shiny object of innovation, how great it is. Let's talk about maybe some of the things that are keeping you up, that the leadership team is constantly thinking about, aside from the headline ones around workforce. What have been some of the other maybe unforeseen challenges that have popped up over the course of the last 24 months, or even just freshly, with this in this new year at the time of this conversation? What are some of those things that you guys are thinking about?
I mean, what we sort of realize, as most do, right, is just the status quo right now is just not sustainable. Um, we face many of the same issues that other health systems do, right? Declining reimbursement, an aging population. For us, our population does tend to be older, poorer, less educated, not as digitally savvy. I think clearly what we're all reacting to post COVID is some of the volumes are not coming back. I think a lot of people thought, oh, it'll go back to the norm that we knew pre-COVID. That's just not the case.
Mm.
Right? So, you talked about workforce, and that certainly is part of it. It's not only though just that we have a shortage of supply, right, for physicians, nurses, and I do think it's more acute in rural areas. But just costs are increasing dramatically as the workforce shifts, as patterns change. The costs are for all health systems, for many health systems, are really increasing dramatically. So we're trying to figure out, how do we adapt to this new reality?
And do you find that attracting people to come to a rural place, what's that been like? Obviously, your circumstances were different, but when you're trying to attract talent, physicians, nurses, what's the pitch? What's the pitch to get people to come?
It's a challenge, right? Because as I said, this is a great area. It's a beautiful area, right? But it is a village of 2,000 people, right? So we don't have a lot of what appeals to people who want to go to the larger cities, right? So for us, it is very much there's a little bit of a lifestyle to it, right? In terms of being in just such a beautiful area. It has a lot to offer in terms of outdoor activities and all the rest. In terms of the hospital, it very much is, again, we have for a hospital in this rural area, some unique assets, I think, right? In terms of our cancer center, our cardiac center. And so, really, it's a place to come, one, to innovate, but also just to develop those very deep relationships with the patients, right? There are stories of how we have treated, the children were treated. We also treated their parents and their grandparents, right? There's such a sense of community here. And so, that becomes part of the attraction, for a lot of
Mm.
people to work here. But it is definitely a challenge, to attract people to a rural area. So that's why we look at telehealth. What are some remote, things that we can do to augment the workforce?
Well, when you mentioned also that your population that you're serving is aging and not as let's just call it digitally astute as others. Well, how have you guys crossed that bridge? Just kind of given the nature of you being the chief digital health officer. I'm curious, where have you been able to meet people on their digital journey? What have been some of the things that you guys have done that you're really proud of to kind of really to cover that gap?
We're still early in the journey, but we've definitely got some wins, right? People are definitely using the portal, right? So we're very proud of the engagement that we have over My Bassett. We're an Epic shop. So using that portal, we really have some good engagement with patients. We've also augmented the telehealth capabilities.
Mm.
So, we are definitely pushing to our community the ability to do telehealth visits, whether it's just over the phone or whether it's video. We've hired, some physicians who are just focused on providing telehealth. And we've been very pleased by the progress and that people are using that. And it's important, right, in this area. As you know, right, that we have patients who live very far away. So,
Yeah,
to travel long distances and during the winter like this through, bad weather. And
yeah.
so, augmenting sort of that telehealth has been very successful. But we have challenges, right? Broadband access is still a problem in this area. Um, people aren't, I walk around with two laptops, two iPhones, and an iPad. Not everybody is like me, right? We still have a
Right.
lot of patients who use flip phones, right? So how do we, maybe initiate a program to provide them with smartphones, right? And then train them how to use the smartphone. So these are programs that we're thinking about to be able to, get people to use technology more.
How do you fund stuff like that? Is that something that you're getting grants for? What's the I mean, because when I think about getting a smartphone and the cost of a smartphone, you're talking 500 to $1,000 per
Yeah.
piece. That can add up pretty quickly.
Yeah.
Where Talk to me about some of the
Well,
thinking
again,
behind
we're
that.
yeah, I mean, we're in early stages here, but it's a combination of things. I mean, we definitely look for grants. We definitely look for funding from the government for projects. Sometimes there's opportunities as we work with some of these innovative companies that they'll help fund that experience. I mean, it's not sustainable. We're not going to be giving smartphones to everybody, right? But to get some traction, it's what we've done to just to start using some of these technologies.
That's really interesting. How big is your team? I mean, you think about being a rural community hospital. Are you a gang of one, or are you talking about other folks that are on your team that help you really push some of these projects along?
No, I'm pretty much. I mean, we have a team. We have a team. I mean, we don't have like a huge innovation department of people who are focused. We all, like I do, sort of multitask with many different roles, but we've coalesced around a group that includes some of our physicians, our chief informatics officer, our chief technology officer. We bring finance in, so we have a group that meets every Friday. We meet at noon. Sometimes we'll cancel, but we have a standing meeting at noon where we'll look at some of the opportunities that we have. We'll get pitches from companies.
Mm,
Um, Depending upon what that company does, then we'll identify stakeholders within the organizations to drive it, right? So, but our philosophy, because we don't have a lot of resources to devote to this, our philosophy has really been one of collaboration and partnerships. So how can we um, collaborate with others? So we have a deep relationship with Columbia, and so we are a teaching school for them. but they are now providing, for instance, telehealth services for us for our cardiac patients. So it's a program we just announced. So we very much have a philosophy of doing partnerships with people. That's what has led us to part of our strategy of partnering with venture capital companies
Hmm.
to really drive our innovation.
We'll talk a little bit about that. That's interesting because you're starting to see hospitals diving more into the venture realm, whether
Yeah.
it be putting a venture office within the health system, or you mentioned partnering with other venture firms. What does that relationship look like today with Bassett, and how do you guys view it?
Yeah, so what we thought about this strategy in really 21, right? And it's to your point, right? We don't have a lot of resources. We don't have a big team. It was the case now. It's even more now. We have all of these companies who are coming at us, coming at other health systems, right? I mean,
Yeah,
every day, whether it's email or through LinkedIn, however, right? You're always getting these solicitations, which is great. You see the opportunities that are out there. So as we thought about, how do we navigate this, we developed relationships with some of the VC firms, in Silicon Valley and elsewhere. And what do these VC companies do? They attract great teams, they attract great ideas, right? And then they fund them, right? And so part of our philosophy was if these companies have gotten through that gauntlet, right, of that the VC firms put them through, that's a good place for us to start sort of our inquiries. So we've developed, some great relationships, with Seven Wires. Um, We've worked with General Catalyst, we've worked with Signal Fire, and then we've also worked with Andreessen. And so just recently, we actually formalized that relationship with Andreessen and announced, a partnership with them. And what it entails, it formalizes the relationship, but it's created some structure around us being able to work with their portfolio companies. They work with us. It's a very sort of mutual relationship, where if something's not capturing our interest, or if there's an issue, we're very open about that so that they can learn, right?
yeah,
And we've had some of these companies come in and shadow our employees, right? So they can sort of see what is the real experience in a health system, so that they can learn what are the real needs that they can address. And so it's been a great way for us to sort of accelerate ours and get a great pipeline of companies that we're looking at. We're not at the stage where we're investing, or that that we've created our own fund or anything. Right now it's more, how can we bring leading edge technologies, innovative technologies here to Central New York?
the operating team, the nurses, the doctors on the front lines. What's their perception of this? Um, how much buy-in did you need from them before you kind of went ahead with something like this?
You got to have sort of buy-in, certainly by projects. I have been it has been really thrilling, really, to sort of see people's reactions when they see some of the technologies and products that are out there, right? People, sometimes they can't even imagine what that world is, and all of a sudden, they sort of
Yeah,
see the art of the possible, right? It's like, I've been doing it this way for so long. Wow, you can eliminate those 6 steps. You can automate that part of what I do so that I don't have to do that mundane task.
yeah,
And so, we've been very focused on getting some early wins, right? So that people can see the benefit. But it's been great to see people's reactions, right? And now change is hard, right? A lot of this
of
is
course.
you're changing workflows, possibly changing sort of the nature of relationships. So you really, you got to work with the team, right? And so that they can see the benefit. It's always about the patient. It's always about the clinical care. That's obviously paramount for us. Um, But so it's a process, but it's been great, as I said, just to see people. They can now imagine a new world, and a new way of working, which is good for them, right, and good for the patients. So
Yeah. And you mentioned, about the partnership with Colombia. I'm curious, are there any partnerships that have come through this new channel with the investment community and some of their portfolio companies that you're able to sort of spotlight and say, hey, here was the problem, and here's how we kind of looked at innovating from the outside, brought it in. Any stories that you're able to share, or maybe it's too early to tell?
no, just a couple last year. We did a couple. It was our first year really on this specific journey. So we brought in, employee safety is a huge issue in health systems, right? Violence, both verbal and physical, against nurses and our caregivers. It's a huge problem here in the United States. So part of what we want to do is, well, how can we improve the safety of our workforce, especially when you consider we have such a dispersed workforce, right? We obviously have you know, good security presence in our main locations, but we have 80 clinics, spread out throughout the area. So we did a deal with a company called Strongline, right, where they have an innovative technology of basically think of as alert buttons, so that if you are in trouble, you can alert, and their innovation is not only does it alert security, it also alerts the people around you. You can program the system so that if it's a nurse in room 203, right, the system will know, okay, that nurse is in room 203, and it will alert the people around there that there's a problem in that room. And so the innovation is being able to alert those people. And so you have a faster response. And studies show that if the first person responding is a security guard, sometimes that escalates the situation rather than de-escalates. If it's other
Right.
caregivers, it can possibly de-escalate. So that's one of the things that we did, for our employees. Another one that's focused on employees is, so many of us are now caregivers at home as well, right?
Yeah.
So we brought in a company called Home Thrive, right, that provides resources for our employees who are also caregivers at home, so that now they have greater support, in the home environment, and may be able to then be able to continue working and not take time off, what have you. But it increases that experience. On the clinical side, we are in the process of implementing a cardiac rehabilitation service at home. So now it's reaching out to our patients. It's in the home environment, and so it's that continuity of care, but also additional care that's now being provided in the home environment for our cardiac patients. And then one that we are still piloting, and we'll be able to announce an implementation soon. Think of it around remote patient monitoring.
Yeah.
It doesn't do it justice, but it's a little bit early yet. But it's so important to know what's happening with your patients. What is their current condition. So this is really sort of next level technology around remote patient monitoring, so that we'll be able to have a better sense of what's happening, being able to intervene, reduce readmissions, all of the benefits that come with that. So some pretty exciting stuff that we're doing.
Very, very cool. So, it sounds as though, a couple of them, it's very workforce related. And as they see you and the leadership team investing in the workforce, well, what has that done to the culture? Is there a way for you all to take the temperature of how providers are feeling? Their overall sentiment, because there's a lot of talk around provider burnout, burden, physician burden. These are things that we constantly are reading about. And friends of mine that are physicians all over the country that are saying, "Hey, it's tough. It's tough."
Yep.
Talk a little bit about that, and maybe where you see Bassett kind of beyond the curve in helping in those areas.
Yeah, I mean, what we've heard anecdotally of what we've already done has been great, especially around employee security. Um, but I mean, we talk about whether there's a shortage of physicians, a shortage of nurses. You know, clearly there are fewer physicians. A lot of physicians left the workforce, so there's been change in the nursing community and the numbers. And so, we definitely need to sort of augment, right, their experience. We got to make sure they're practicing top of license, not doing redundant tasks. As we bring in more of these technologies, right, you've got patients emailing our physicians. So you have all of that, they call it the pajama time, right, where they're responding to messages and patients expect a response. And this is just all increasing the burden. So, what I foresee coming next for us is, how do we automate a lot of that? How do we apply artificial intelligence, natural language processing, right, to be able to, eliminate, a lot of those redundant tasks. Now, we'll always need physicians and nurses to sort of monitor. So, just think about the number of messages that come into physicians. What if we can start automating those responses, right? The physician will want to sign off on it before it goes to the patient, because we're talking about clinical
Yes.
issues. But how much better if they can just look at a message that's already been prepared for them and just hit send, rather than having to, type it in themselves. So we're
Yeah.
really into to a lot of the ways of how we can, augment the workforce and make that everyday experience better than it is today.
Well, if there's one thing that has stood out from our discussion today, it's that despite being in a rural area, despite being placed with constraints, it hasn't stopped you and the team from attempting to innovate, from doing new things. And that's like the one major lesson. It's like, hey, look, you can have everything stacked up against you. Doesn't mean you can't try. Doesn't mean
Right.
you can't do it. And
Yeah,
it's
I mean,
very encouraging.
when we have to do it, right?
Yeah. I was like, you don't have any other choice.
There is no choice, right? I mean, other health systems have, resources and funds to do a lot of this. Small rural hospitals really don't. And so this is why we've had to find innovative ways to drive this program, right? And, certainly want to work with other hospitals, to help them along as well.
Talk about how
We
you
have
guys collaborate with other rural hospitals or with other hospitals in general that aren't sort of the larger entities, the well-known names. What's that collaboration like? I mean, do you have relationships with other health systems that you kind of continue to keep tabs on?
Yeah, I mean, especially with some of the health systems in this area, right? We're having discussions with them again in the spirit of sort of partnership and collaborations. How can we share resources? How, when we see something exciting, how can we, bring it to them? And so, we're in those discussions with health systems, in New York, so that we can collaborate on some of this stuff. And we're part of coalitions. So we're part of a coalition of like-minded health systems that are looking at similar opportunities. And it helps really de-risk it for us, right? If we're there with a group
Yeah.
of our peers looking at these opportunities, or even incubating some of these opportunities. So there's definitely coalitions that have been created, where we can look at these opportunities. But it's absolutely necessary right now. I mean, I think the latest statistic is 600 rural hospitals are at risk of closure, because of their economic circumstances. And as a country, we just can't let that happen, right? And so, part of what we're also doing is balancing what we need to do in the short term, right? And also what we need to do in the long term, right? To make that shift to value-based care, to make that shift to a different experience. And so it's a challenge, but it's one that we're embracing and taking on.
So for any of the earlier stage digital health companies that don't have the luxury of being selected by a General Catalyst or an Andreessen Horowitz, what's your message to them in terms of continuing to fight the good fight and wanting to partner with, I'll say, longstanding entities like Bassett? What's your advice for them?
I think I don't think there's anything that others haven't thought about. I think the big challenge, I think there's two big challenges. One is just one, how do they differentiate themselves, right? I mean, it's so, what I find is a lot of companies sort of use the same words to describe themselves, right? And so
The same buzzwords that everyone uses.
exactly, exactly. And so it's just so important to be able to really differentiate, right? And I'll ask companies, well, who's your competitor? And often I'll get the answer, well, no one is. I kind of doubt that, And so, how do you really differentiate from others? I think the other issue that a lot of these companies face right now is there's so many point solutions, right? And so we as health systems, I think, are struggling with that, right? It's so many different arrangements, and it gets down to something as basic as how many negotiations do you have to have, how many contracts do you need to have, but more importantly, it gets to how many implementations. Our patients don't want to go to a whole bunch of different portals, right? They want to come to one, right,
Yeah,
in our environment, right? So how do all these point solutions, they need to sort of address that in a way that makes it easier for health systems, and that'll make it easier for them, if that makes sense.
absolutely. It makes a ton of sense. And for your peers, other fellow digital health officers, other leaders that are innovating, if there's one golden nugget you can leave them with, that I would call it the tactical execution. What would that one thing be that you could get to them?
Well, I think we all know it's not as easy as we would like it to be, right? And it's always about,
Sure.
so often just about, what are those workflow implications, right? And that's the one that I learned that in the health information company that I worked for. It was so much about the physician workflow and just how do you engage in that change management? Because to me, that's the key. If you don't bring people along that change management, it's just not going to work.
Absolutely. Well, for those that have joined us, if you found this information helpful for you, would you mind sharing it on social media? Would you mind liking it, commenting it, even just reposting it with your network? I'm very grateful when we have key leaders like Paul that are coming on, that are not only just sharing wins, but they're sharing, things that haven't gone well, and just being very authentic. And the more doers, the more folks that we can coming into our community, I think the better off we are. So Paul, it's been a pleasure to have you on today. I appreciate your candor, your level of just authenticity. It's refreshing.
Right? No, it's been great to be with you. Thanks for having me.
Wonderful.